The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Welcome to this webinar. My name is Strahil from Empirica. Thank you very much for joining us. I see that we have 16 participants. In this webinar, we would like to present to you an opportunity, a funding opportunity, the so-called Twinnings. There is an ongoing call right now, and you can apply. And we'll try to explain to you a bit the background on Twinnings, how they work. We have an example twinning experience to be shared by an already running twinning, and we'll allow also some time for questions and answers you may have. Can I just ask really quickly if you can hear me well? If someone can write in the chat. Okay. Great. And you can see the screen. So let's start then. This is the agenda we have, and you excuse our project officer, Birgit Morlion. She cannot attend from the Commission side. I guess they are having some troubles around the coronavirus, canceled meetings that they need to attend, reorganize and plan. So she's quite busy. She will not be able to attend, but I will try to convey some of the messages related to the policy priorities. We'll then introduce the call for Twinnings, and again, as I said, we'll have some short presentation of the experiences of one concrete twinning. And then in terms of questions, please do post them. You can already put them in the question section of the webinar using the GoToWebinar functionality. We'll try to answer as many as we can, but please do understand that some of the questions I might not be able to answer live. I have to consult either with our team here or even with the Commission if there are very specific questions on the funding. Okay. So a brief overview. The twinning scheme is part of a European project, a coordination and support action called Digital Health Europe. And it is a 2.5-year project that involves quite a few partners, 17. You see the logos here. We are basically, through the project, supporting the European Commission in facilitating the implementation of key policy priorities. And we'll see in a second what kind of policy priorities those are. And one important element of the project is the so-called Twinnings, which are real on-the-ground implementations and scaling up of solutions from one country or region in Europe to another. This is an overview of the project. So the project is bigger than the Twinnings themselves. We are focusing on 3 policy priorities. Those are citizen secure access to and sharing of health data, better data to promote research, disease prevention, and personalized health and care. And the third policy priority is digital tools for citizen empowerment and for person-centered care. Now, these 3 priorities, if I can skip to this slide here, are directly linked to the 3 priorities defined by the Commission in their communication on the digital transformation of health and care. This communication came out in April 2018, and the Commission has put forth actions and activities that need to be undertaken on member state level by the various stakeholders in Europe to achieve those 3 main priorities. And you see here the infographic that the Commission is using to convey the message around the key messages around the 3 priorities. We are, again, with the Twinnings and with the Digital Health Europe project, we are addressing all 3 of them. If I may skip back to the overview slide. So within these priorities, we are trying to organize the different communities of stakeholders to be able to support the Commission in elaborating policy recommendations and in the form of white papers and guidance documents. But you can see here we are also offering through the project a number of services for real implementers of solutions. And one of those services, a big part, is the twinning activities. Okay. So what are twinnings in brief? Well, if I had to summarize it in one sentence, I would say that twinnings are a mechanism that we use to avoid reinventing the wheel, because we know that there are some good practices out there, health and care practices, that can be replicated. So we don't want to reinvent the wheel, we want to share knowledge. That's what the European Union is about. And that is why the Twinning scheme focuses on sharing knowledge, enabling the sharing of knowledge between different organizations in Europe. And we're focusing on digital solutions because that is our client in the project. It is DG Connect. So the Twinning scheme is a support mechanism, and we are aiming to accelerate the scaling up of digital innovative solutions. And we are doing that by providing funding through a twinning scheme. You see here a bit the overview of the key ideas behind the twinning. So we have a call for tenders, call for applications, which is running right now, and you can apply to. Once you apply as a twinning pair, you then are able to carry out the twinning. This is in the middle part here. We are also facilitating the process as needed, depending on the different twinning you're doing. And we are using this information on the one side, obviously, to scale up solutions to others, but also learn from them and formulate what we call building blocks. So basically different kinds of materials and guidance, all the lessons learned from the experiences of the twinnings that we can use to benefit others who would like to do similar things. So again, not reinventing the wheel and documenting what has been done so that we avoid mistakes and that we can learn from the good experiences of the twinnings. The main subject of the twinning is what we refer to as twinning solutions. And twinning solutions are the digital know-how which is transferred through the twinning activities to the twinning adopter. So you see already some concepts in the previous slide. Actually, we always have one twinning originator. This is the organization or institution that owns the good practice. So it has already been implemented in one region or in one city. It is going well, and now the solution is mature enough to be able to be transferred to others. The others we call adopters. A twinning can be have one adopter or many adopters. So the twinning solutions that are being transferred can be products, services, processes, methodologies, strategies, and business models. So it's not really only about services that we're talking about. It can be a methodology that is quite useful and that can be used in other contexts. The topics must be based on digital technologies and they must be innovative. And we've defined what we mean by innovative in the call documents. Now, there are many different topics that you can apply to, and that's why we've provided in the twinning call some examples. It is a non-exhaustive list, but it is a good list of examples of potential solutions. I think we have a slide on that we'll see in a second. The other key aspect is that we know that there are various types of twinning that require different, that have different needs and requirements. So we have grouped the twinnings in 3 different types. The so-called knowledge exchange and training twinning. So these are smaller twinnings in terms of scope, where funding is provided mainly for organizing meetings and travel to exchange knowledge on a specific topic. And then we have 2 other types, partial adoption and full adoption, where usually services or products are being transferred by, for example, an application can be translated into a different language and implemented into the systems of the adopters, or even more complicated solutions. So we have these different 3 types of twinnings, and behind each of them we have different funding limits. So here are some examples related to the 3 priorities that we showed earlier. If we take, for example, the citizen secure access to health data, there are twinnings that can focus on data governance, on health data cooperatives, health data donation, for example. If we take a look at the second priority, it can be any twinning solutions that relate to real-world data, even in genomics, because we want to involve different types of communities. It can be genomic data, big data analysis. So the policy priorities of the Commission are quite broad, and many of the things you are doing and you have good mature solutions you'd like to share with others or are looking for are mainly in this list, we hope. But of course, again, we have the category of other. So if you think you have a solution that fits the policy priorities of the European Commission on that subject, then it will be eligible for receiving funding for the twinning. The third priority, the digital tools for citizen empowerment and person-centered care, is by far the broadest, and it includes many different topics like telemonitoring, even robotics. So again, the opportunities are great, and your topics probably fit into one of these categories here. So we've done this twinning call, a first call, back in the summer of last year, and it was so welcomed by the Commission. The Commission really appreciates this on-the-ground learning and scaling up that we would like to do a second call for Twinnings, providing even more funding. And here are some examples of the Twinnings that were funded in the first twinning call. So they will also give you an idea about the topics that were submitted. So we see, for example, that we have a mobile app on preoperative patient preparation before a major surgery. We have medication adherence and polypharmacy management system that is being transferred from one region to another. We have an mHealth tool for prescription adherence. We have Absolutable, which is a guideline of safe practices for healthcare app developers. This relates to the third priorities. We have a medicine shortage detection system, which the originator is now transferring or teaching the adopters how this successful system can be used in their own contexts, etc., etc. So yeah, I wanted to go into just a bit more detail about the several examples. One is the so-called Absolutable. So this is a twinning between the Andalusian health system, they are the originator, and the adopter is the Portuguese Ministry of Health responsible for the IT side, SPMS. And what the Andalusian colleagues have is a quite well matured scheme for app certification. You know that mHealth is a popular topic right now. Certification is varies across member states. There are not too many good examples of good schemes, but it seems that Andalusia has one, and they now want to share this knowledge with the colleagues from Portugal, so that they end up at the end of the twinning with a mutual recognition scheme for app certification, which will be great because an app that is being certified in Portugal at the end of the twinning will be able to automatically be included in the catalog of the region of Andalusia and vice versa. So that's one example of twinning topics. Another example is the so-called SCAN. This is strengthening the capacity for the analysis of electronic healthcare data. So it is between Croatia and the UK, where the UK has a good practice related to use of analysis of electronic healthcare data to monitor medicine safety, and they're now through a series of workshops and meetings, they're teaching how elements of this practice can be used. So back to the three types of solutions. If a solution, because we know that healthcare systems across countries are very different, if a solution cannot be transferred one-to-one completely, 100% from one place to another, then most probably you'll be looking at partial adoption, where you're trying to take the best elements of a system, the best aspects, instead of just transferring the whole, let's say, technical solution, if it's a technical solution that we're looking at. And then we have a third example where we actually have one of the participants in the webinar who can tell us more about it. We've invited Willy Allegre from Kerbape to explain a bit their experience so far with the so-called Rehab for Lab Twinning. This is a running twinning It will run until August, if I remember correctly. And we asked Willy to just share a few sentences about the experience so far. Willy?
Yes, thank you, Israel. Yes, 4 years ago, we started to launch what we call Rehab Lab, a fully integrated fabrication laboratory within a rehabilitation center or medical social organization. After 1 year, we decided to help other French organizations to mount their own rehab lab, and rapidly we have developed a community of 10 organizations sharing the same idea, that is to involve patients with disability into their rehabilitation process by designing their own assistive devices with the use of 3D printing. So when I talk about assistive devices, I mean objects, small objects of daily living. And so this twinning, Digital Health Europe twinning we are involved in right now, really help us to transfer this innovation at a national scale, from a national scale to a European one, to help 3 other organizations coming from 3 different countries to launch their own rehab lab through trainings we are actually given to them. And behind it, there is also the launch of an IT platform to share practices, objects, also digital objects, and also to share a common charter which will provide guidelines and values, ethical values also behind this kind of dedicated space. Yes, it helps us a lot to scale our innovation up, but also to learn from partners with different type of environments related to medical devices, for example. And yes, the result will be integrated in the so-called common charter. So now, during the Digital Health Europe twinning, we have a lot of different organizations asking now how to be helped to mount their own rehab lab also. So beyond this opportunity, we have now to find a frame to develop the community further.
Thank you, Willy. Indeed, that's, I think, a great example, and we're happy that you are also interested in submitting a new call where you want to include additional adopters. And you had a question about that. To answer it, actually, we're happy that you want to submit. It just has to be different adopters. But as long as that's the case, it will be great to apply again.
Great.
Okay, thank you. So to facilitate a bit the finding of partnerships, we are offering the so-called Twinning Marketplace, because there are some organizations that are quite active in networking and have very good source and contacts, and they know what they want. So it's easy to find partnerships there, but there are many who don't. So that's why we're offering the so-called Twinning Marketplace. This is an online tool. It's a forum where you, as an originator of a solution, if you have one, you can offer to share your experience with interested adopters, or the other way around. If you're an adopter, you can indicate in the Twinning Marketplace that you're looking for a solution for a specific topic, and we're trying to facilitate the matchmaking between Twinning originators and Twinning adopters. Again, Twinning originator has to be one organization, and it can be one or more Twinning adopters. By the way, the question about the slides, I've included the slides. Check the GoToWebinar functionality under handouts. There should be now a file that you can open, and if you have a different pace, you can go back to some of the slides that we showed. but also the webinar is being recorded. So if you missed something, it will be shared on the Digital Health Europe website. So looking at the budget, we've reserved almost 400,000 euros for the second call, and this is divided among the three categories that we mentioned. There are some limitations that result from the fact that this twinning scheme and the twinning call are part of a European project. Now, we are recommending to the Commission that in the future that kind of scheme should become a funding instrument on its own, but right now it is not. It is implemented as part of a European project, so we need to abide by certain Horizon 2020 rules, which makes things a bit complicated in terms of different categories of costs, and those are all described in the call for tenders, but it is what it is. We have to work with. So we have different types of twinnings. For each, we have a maximum of costs that we can provide. This is 5,000 euros, 17,000, and 43,000 for the full adoption type of twinning. And then we have a cap on the subcontracting category because again, as a European project, we have certain limitations on how much subcontracting we can use in this. And one of the popular question is, if I have, for example, multiple adopters, is this price then per adopter? No, that's not the case. This price here that you see, the maximums are for one twinning, which we understand as a collaboration between one originator and one or more adopters. Then the other question that we receive is, why would I then share the money with multiple adopters? Well, if you have multiple adopters, you are scored favorably when it comes to looking at the submissions, because obviously if you have more adopters, then the impact of the twinning is higher and will be rated higher and with better score, because this is, after all, a competitive application, the competitive tendering application. So we have a number of twinnings that we can fund, and if we receive more than those numbers, then we have to make a selection based on the criteria that is listed in the call for tenders, the so-called award criteria. Yeah, that's basically this here. The twinning scheme is indeed in the form of competitive twinning tender, and the focus is on local, regional, and national health and care providers in Europe that wish to adopt such solutions, or which are available to transfer those to another local, regional, national health and care provider in Europe. Now, in some cases, we are aware that there are private organizations that have been part historically of the development of the solution with the originator. We know that originators, healthcare systems work with such private companies, and their knowledge is needed for the originator to transfer effectively and meaningfully the information and the knowledge to the adopters. So organizations like that can be included, but again, the focus will be on local, regional, and national health and care providers. So the role of any IT provider, for example, should be secondary in the twinning and not decisive. Twinning activities must involve, again, the transfer of digital know-how, because we're in the digital era, and twinning originator and twinning adopters must be from different countries. In case of multiple adopters, at least one adopter should be from a different country. A twinning tender must be submitted by a single organization. Those are details that you will really find in the call for tenders. We call that twinning contractor, and support is provided again in 3 different categories. So I urge you to look at the call documents. We can fund personnel, we can fund direct costs, and subcontracting. So for example, in the case of Willy's twinning, Willy, I think you have some personnel and some direct costs for travel and meetings, right?
That's it, exactly.
Okay. So there are different conditions for these standard Horizon 2020 conditions. They are listed in the call for tender, but of course, if you have questions, please do ask. There are several documents that constitute the call for tender pack, and it is available on the website. If you go there, you can download this pack. So the main document is request for twinning tenders. It includes all the information related to what twinnings are about, what the budget, the calendar, in schedule and information on the tendering procedure and eligibility criteria. We also offer 3 different templates that need to be filled in: administrative, technical, and financial. And these 3 together must be submitted. If you want to submit a twinning tender, those 3 must be sent to the email specified here. Again, everything is in this main document TD0. And by submitting the application, we'll then proceed to evaluating it and letting you know whether the twinning can be funded. Twinnings are then evaluated by a dedicated independent expert board that we at the project will engage, and they will be evaluated against exclusion, selection, compliance, and award criteria. I've just pasted here the different award criteria that we're looking at. So twinnings should be innovative. They should be mature solutions, because we don't want we want the project to succeed, and we've seen that only mature solutions make sense for scaling up and replication. We want already solutions that have proven effectiveness that can be shared with others. Value of benefits for patients, for the healthcare systems of the adopters, feasibility of scaling up are just part of those award criteria that Twinnings will be evaluated on. And based on that, we're also applying a quality price weight, because we don't want just to orient ourselves according to price. Quality is important. And based on that score, we'll be able to make the list, to conclude the list of twinnings that can be funded, and we expect to announce those twinnings on the 22nd of May. The actual twinning scheme, the application period, ends on the 4th of May. Yeah, exactly. That's the twinning calendar. So let me check if I got it wrong. Exactly. The deadline for submission of twinning tenders is the 4th of May. You can ask questions by this deadline here, the 10th of April. And we expect to be able to announce the decision on the 22nd of May. We then go through the process of contracting, and twinnings can start from July. And again, depending on the different types of twinnings, we have different timelines, because the knowledge exchange and training twinnings, which receive smaller budgets, they're more focused, and they are given a tighter deadline compared to the full adoption twinnings, for example, which last for about 8 to 9 months time. That was the overview, the brief overview of the twinning scheme and how it works. Now, I will have a look at any questions that have been submitted so far. I'll try to answer as much as possible what I can now, but for some I will have to ask you to wait a bit. We're collecting those. The webinar is recorded, so we'll be able to look at them within our team and be able to answer them. Any questions and their answers will be published on the website on DigitalHealthEurope.eu. So let me check what kind of questions we have so far. Will the slides be shared afterwards? Yeah, well, they have been shared in the GoToWebinar application. So if you cannot download them, let me know, but I hope that's cleared. Okay, yes, so again, the webinar is recorded. I guess those who could not attend will send an email with the link to the webinar recording and with the attached presentation. Can universities or other learning institutions apply? Yes, again, the focus is on local, regional, national healthcare authorities, or healthcare providers, but other institutions can apply it. It just depends on how you can specify their role. For example, the university has been involved in developing the solution, so that's perfectly natural that they are also needed in terms of knowledge and experience to share with the adopters. If I am right, there is a useful question and answer set of questions and answers. Exactly. So there are already some questions and their answers from the previous call for twinnings. We haven't changed the scheme too much compared to the first call. We've just, for example, merged some twinning types. We don't have the twinning type called adoption anymore. Adaptation. So there are some small differences, but many of the questions and their answers are, I guess, already provided. So it is actually a very good tip to look at the website again, the existing question and answer document, because some of those questions might already be answered. What is the difference between this call and the EIP on AHA call? And are they working together? Very good question, thank you. So the EIP on AHA, European Partnership on Active and Healthy Aging, is also having a twinning scheme. The main differences is that the twinning scheme of the EIP on AHA focuses on obviously the domain of active and healthy aging, which is just part of the overall scope that Digital Health Europe covers. And they're also, the scheme itself is smaller because they're funding up to 5 twinnings of the first type, knowledge exchange and training. So we've actually decided to team up with them in terms of disseminating the idea about the twinnings and getting people on board, because they are very similar concepts. They have, although different funding requirements and different call. So in our twinning call, we've actually made reference to them. If, for example, your solution focuses specifically on active and healthy aging, then it might be that the EIP on AHA call is better suited for you. It is up to you. You have to just look at the requirements. Obviously, we are funding more twinning, so the chances of getting funded are a bit better. But yes, we are working together with them, with the EIP on AHA twinning call, and you have to select which one you would like to apply to. Both have the same deadline, but different call requirements. Does the adopter have to be a local authority, or can be in general a local healthcare provider, for instance, an enterprise? A local health, so it is a private healthcare provider. I have to refer to my colleagues for that, but I could imagine yes, but I would suggest to wait for the official answer. We'll include that in the Q&A document. Okay, any other questions? Please feel free to either write them in the text, or I see that someone has raised their hand, so I need to check how that works. This is new to me as a functionality. No, nobody has raised their hand right now. So one other question, it could be useful to clarify if only EU countries are eligible, or if organizations also from pre-accession countries can apply. Thanks, Matteo. This is a very tricky question, and this is one of the questions I have to, again, deter for now, and we'll answer this via the Q&A. There's one question about the marketplace, so maybe we can briefly show how the marketplace works. If you go to the website, under Twinnings, there's a Twinning marketplace that you can go to. Again, it is in the form of a simple forum, so it does require registration. You can actually see what kind of offerings there are so far, but if you would like to post something, you need to go through a brief registration period and see, for example, someone that has posted about a solution that they are offering as originators. And interestingly, this is one twinning that was funded in the first call, because people were able to find adopters, and vice versa. Someone was able to find an originator for a specific topic via the forum. So do have a look. This is also another one, my prescription, that resulted through the Twinning marketplace, where the originator, I think coming from Andalusia, posted describing the type of solution that they can offer knowledge on, and then they through the marketplace were able to come to a collaboration with the Italian partners here, if I remember correctly, and they're running a twinning right now called My Prescription. Okay, going back to the questions. Will the call for tender be organized in 2 steps, the first for the originator and the second for the adopter? No, the call for tender, the idea is that during the tendering process, you have to find a partner. You have to establish a partnership. So either you already know about someone you would collaborate with, or in this case, you can use the Twinning marketplace. But the idea is that you apply, just like in European projects, you apply as a consortium. You apply as a consortium here a pairing of one originator and one or more adopters. And usually this is done by the originator, the application itself, the one we call Twinning contractor. So it's a joint application. Okay, any other questions? Are solutions about dealing with infectious diseases included in the call for Twinnings? For example, I see there is a big data analysis, preventive medicine, and treatment. A good question. I'll go back to the list of suggestions. Again, those are just suggestions in the call for tender. If you have other topics that relate to the 3 priorities, you are more than welcome to submit a Twinning on different topics. If we see here, I have to check, but I do think we have infectious diseases somewhere. I just need to spot them. Yeah, digital tools for public health, epidemiology, pharmacovigilance, clinical research. So I would say that this is definitely where this would fall under, especially now with the coronavirus. If there are some novel solutions, methodologies that really need to be shared with others, that would be also a good way to do it through the Twinning scheme. Okay, going back to the questions. I don't see any new questions. Okay, then I would say thank you very much for your attention. I hope that this sparked your interest and you might be interested in submitting a Twinning application. Again, the deadline is 4th of May, and we are also planning a second webinar just in case you would like to ask something more or you just like to revisit this set of slides. It will be the same slides that we'll use to inform people about the Twinning scheme. The second webinar is on the 8th of April. And again, as said, we'll put everything that has been said so far with the recording and the presentation slides on the website. So be sure to check out the website. It will be updated right after the webinar. Thank you very much and stay healthy. Bye-bye. Bye-bye. Thank you, Willie.
Bye. Thank you.